Well, I like to see just the requirements for surgery change a little bit, because it's very much based on a point scoring system. And I would like to see them step it back a little bit and focus on what actually really matters, which is your enthusiasm, your determination, and your core skills, if you actually have these skills. And they're very much focused on point scoring, competition, and I think sometimes you can find yourself in a situation where things might seem a little bit unfair. So, for instance, if you just never thought about doing surgery before through medical school, you were just like open, which people should be, to other different career paths in medicine or even beyond medicine. And then later down the line in foundation training, when you get a bit of experience in your foundation years in surgery, and then you realize this is what I want to do.
And I breathe. One touch feels skinny.
Hi, Joanna. So sorry.
Was it you or me? I wasn't sure. I sorted it out.
Yeah, thank you. That sounds great. Sorry about that.
That's okay.
Because I was on a different call, the wrong call. So sorry.
No.
So what did you do in the end?
Because the call obviously cut short, and then I went back to rejoin. And then when I was going to rejoin it, that's when I saw the setting about no background. And then there were also different, like, very suave backgrounds that I could use.
Okay, that's
good.
This
is nice.
So,
this is nice.
Yeah. Thank you. Putting IT skills to good use. Yeah. I think this is much better, actually, because it's not too strong on the eyes, if that makes sense.
Yeah.
So today's call is just basically, it's very simple. Forget the fact that I'm wearing scrubs. It's meant to be as informal comes. So normally I do the in-person interviews. I've done it with people at work. It's just basically jumping on my phone, shooting a quick video. We normally wear mics, but online, you're the first person.
I've got a mic, actually.
It's fine. I think your voice sounds fine. No, your voice is great. Your voice is great. Yeah, so I hope to do more of like virtual interviews because it's easier for people. You can sit in the comfort of your house. We can arrange an interview if that makes sense. So the whole purpose is just to find out about people's stories, and in the hope that these interviews will inspire the next set of doctors coming into the NHS and sort of make training easy from a knowledge point of view. So like when you're starting F1, if you are interested in surgery, you know you need to start doing certain things like applying for diplomas, masters, getting your portfolio together, what you need to do, preparing for exams. With more time, you can plan better, increase your chances of getting into surgical training. So So speaking to you, you're perfect for what we want to do today. So you can share your story about surgical training. So I'll just get into the interview. It's just asking you a couple of questions, and so you can take all the time you need to answer them. Yeah. So just to start off, can you tell us your name, please?
Right. Okay. So I am Joanna, or you can call me Joanna Uchogu. Yep.
Good. I mean, off to a good start. And can you tell us what you're doing at the moment? What type of doctor are you?
So I'm a surgical trainee, core surgical trainee, second year of my surgical training. Everything.
That's good. How has it been for you, like, since medical school? What has your career path been towards getting into CT2, like they call it?
So I did, obviously, foundation year 1 and year 2. And in the second year of foundation training, I applied for core surgical training. And so I went straight from F2 to CT1 and then CT2 after that.
Oh, wow. Congratulations.
Thank you.
Because not many people get to go straight from F2 to surgical training.
Yes, true.
And how has core surgical training been so far? Any pain points that you've experienced to date?
So it's been a roller coaster, I would say. It's been really good. It's met my expectation, and it's also been overwhelming as well at the same time. So it's good in the sense that I've been doing surgery, so I'm doing what I want to do. So I'm getting to do some operations, and it's sort of like reaffirmed that this is what I want to do in life, and because I'm enjoying it as well. So I'm just like I'm on the right route. I didn't anticipate it to be quite tasking. So it's essentially like being in, I suppose I am in training, but I just thought to be like foundation training, just a little bit more like relaxed as foundation training, where you just go to work and then you get signed off in the end that you've completed foundation training. But this is a little bit more intense than that. And I didn't anticipate it to be like this. So you have expectations in terms of your logbook, the surgeries you do in the logbook you do, and to what level that you do it up to. So at the end of CT2, they're expecting you to get at least the level 2 at what you're doing.
Okay.
And we're expected to do at least 80 cases every 4 months. So by the end of CT2, you should have at least 200 and something cases of operations that you would have done, and also have done at a certain level as well. So, and then also there's the academic part of it where you're expected to do audits, and then you're also expected to pass your MRCS, which is your membership examination, and with the Royal College of Surgeons, England, Edinburgh, or whatever. And you're expected to do that by the end of CT2. So you're expected to pass your Part A by the end of CT1, and Part B by the end of CT2. And these exams are tough. So not only are you obviously trying to build up your sort of like theatre experience and build up your practical skills, you're also doing audit, and then you're also studying for exams. So I found it quite challenging in the sense I actually just expected a smooth ride. I don't know why. I just expected to go into theatre, just did my operation and just got home, and I was like, yay! And then that was life. And I thought the difficult bit was getting the job, but actually it stays a bit tough, and no one actually, I think that's the thing, because no one actually told me about how tough it was going to be, and so it took me by surprise.
Okay, if there's one thing that it could have helped you, what would that be? If you had a magic wand and they said, what would that have been for you?
So what I would have done is I would have done my membership exams before starting core training, or maybe completed both of them by the start of CT1. So that's what I would have changed. So that would allow me to enjoy the surgeries more, to learn more about surgeries beforehand, and actually participate more as part of the surgical team. And I think will be a better surgeon if I did that, and it would have allowed me to prep my portfolio for the next step, which is registrar training. So the thing about the thing about surgery is you always have to think 2 years ahead. You can't, it's a bit annoying because you can't just enjoy the moment. You need to think of the next 2 years, and the thing that you're doing now is supposed to be aiming for what you want for the next 2 years.
2 years.
In preparation for it. So one thing I'd have done is I've done the MRCS with the membership exams, and then whilst I was in core training 1 and 2, used those 2 years to prepare me for the registrar level. So that's what I would have changed.
That makes sense. So before you got into surgical training, did you have like a mentor that sort of prepped you?
So I didn't have a mentor, but I was so desperate for one. I wish I had a mentor. I'm still looking for a mentor at the moment. So I've joined the British Association of Black Surgeons, and they are allocating people, mentors, mentees. So that's quite good now. I wish I had a mentor. So I did a lot of independent research into what I needed to do, and just spoke to my colleagues and spoke to people who were trying to achieve the same things, and just essentially did everything on my own. So which is a lot more overwhelming because I didn't have that person who could give me advice. And I think looking back now, if I had a mentor, I would have known in advance where I needed to do, where I needed to be at a certain time, and what I needed to do at certain times in order to prepare myself for what's coming. So
that does make sense. That does make sense, because it is a very intense training scheme to be going
Yes.
through, and like you have exams, you have lots of different parts. It's like it's almost as though you don't have a life, if that makes sense. Yeah,
Yes.
yeah. That's good. Thank you so much. And what would you like to see change with surgical training? Obviously, I know they're the good parts, but like, what would you like to see change in the next few years? Because my guess is this is your career path. You're going to see this through to consultancy and CCT. What would you
Yeah.
like to see change?
Well, I like to see just the requirements for surgery change a little bit because it's very much based on a point scoring system. And I would like to see them step it back a little bit and focus on what actually really matters, which is your enthusiasm, your determination, and your core skills, if you actually have these skills. And they're very much focused on point scoring, competition, and I think sometimes you can find yourself in a situation where things might seem a little bit unfair. So, for instance, if you just never thought about doing surgery before through medical school, you were just like open, which people should be, to other different career paths in medicine or even beyond medicine. And then later down the line in foundation training, when you get a bit of experience in your foundation years in surgery, and then you realize this is what I want to do, you actually find yourself in a disadvantage compared to someone else who has always thought about doing surgery, throughout medical school and have worked for their portfolio throughout that period. And you'll be years and years behind these people. The application doesn't work in your favor at all because it rewards all those people, and they should be rewarded because they've worked hard all those years. But it doesn't allow people who have now newly discovered their new talent and skills in surgery to also compete fairly with other people. So I think it should allow another pathway to exist for those kind of people to apply and have the opportunity to get into training and actually do what they want to do, rather than find themselves in a disadvantage and in competition with people who have had years in preparation for training. So that's one thing I'll change. And the other thing I'll change is, if I obviously could change anything, is exams. Exams are difficult, very difficult, and sometimes doesn't actually reflect what you see on a day-to-day in surgery. In terms of actually your specific specialty that you're doing. The Part A exam was very broad, and there's a lot of physiology that you haven't even touched upon since first year of medical school, and is now coming up again. And these are questions that you will never see in reality, in practicality, working as a surgeon. So why are you testing this knowledge? Why aren't you testing surgical skills and things that are applicable in your everyday surgical life? So change that. And then what I would like to see again in surgery, especially in specific parts of specialties in surgery, is diversity. So I would love to see more women in surgery, more women being able to thrive in surgery and do well in surgery without thinking of, pressure from, having to take time off because they're pregnant, and thinking about less than full-time in training and how to be of a disadvantage to them and be behind their peers. And then I would like to see more Black people in surgery and thriving in surgery, and more Black people encouraging other Black people and giving them the resources that they need to thrive and do well in surgery. So those are the things.
You make a lot of sense, Joanna. And I actually wanted to say well done for coming this far. I know it's still, you're still thinking of all different things you have to do, but actually congratulations on getting this far.
Thank you. Thanks very much.
It isn't easy. Yeah, it is easy. I know I applied, but I didn't get a core training job. But then I went and locumed, and I love GP. And I wanted the flexibility, but I know how difficult it is. I know the point-based system. I know how hard you have to study and how hard you have to prepare. And like, you feel like you're always a year behind if you don't start on time. So that's one of the reasons that inspired me to start Oddarra. Actually, can we provide people with the knowledge and the information that they need once they are going through foundation training to say these are the different career options? Can we start getting people to come and talk more about their stories and seeing how best can we help the next person coming through, because it could be the difference between somebody living what they absolutely love, which could be medicine, which could be surgery, and going for something else because life just is different for them at that particular point in time. So yeah, so I'm sure this is going to help somebody out there. I don't know who it is, but thank you so much for doing this. Thank you so much for doing this. Today I met somebody who heard about what we're doing. I'm like, I've never met the person before. So you get stories like that of people coming and people finding this resources helpful. So thank you very much. The hope is to build. Thank you. The hope is to build a community of medics supporting medics. And I know there are more organizations out there, but where Oddarra comes in is the transition points between medical school and F1, and sort of supporting people and giving them the support they need to thrive in whatever medical specialty they want to go into. So thank you very much. But it was nice hearing your story. Thank you. Because in my head, I thought you took a year out and then you went into surgical training.
Wish I did.
Yeah, I do have a friend who was with me F1, F2. He's now got a job because the training numbers and all those jazz, which is difficult to get. But he's now starting a CT2 job I think it's in Nottingham. So I hope to get him. Yeah. It's tough work, but I hope to get him on to come share his story one day. But yeah, it's good to hear people's stories. Yeah, it gives you extra fuel and motivation you need. Yeah, it gives you extra fuel that you need. Yeah,
it does.
But thank you very much.
You're welcome.
Yeah,
you're welcome. Thanks for having me.
And
it's been a pleasure.
That's the end of the interview.
Thank you.
I'll let